Good day, ma'am. I am Denise Kate Cabiedes and I will be performing the sterile perineal care and Perilight checklist. So for the first procedure is I will be gathering the materials that I will be needing. So here I have prepared my draw sheet or underpad to protect the bed, my betadine solution to clean the perineum, and also the cotton balls to clean the perineum, sterile thumb forceps to hold swabs for cleaning, kidney basin or dipper to receive the waste, clean linen to make the bedding clean, pads and dressing to keep the patient clean, bedpan to clean the perineum, or it can also be used if the patient has a need of passing urine or stool, small towels to dry the perineum, drape sheet and screen to maintain the privacy of the patient. So after gathering the materials, I will now prepare my patient. So first is to explain to the patient the procedure that I will be doing. So good day, ma'am. I'm Denise Kate Cabiedes and I will be your student nurse for today. So before proceeding, may I know your full name first? May I check your identification bond? Okay, thank you so much, ma'am. So today I will be performing perineal care to you, on which I will be cleaning and providing care to your genital area. So this will help you to heal faster and make you feel better, and also this will help in preventing infection. Also, after cleaning, I will also be doing Perilight exposure, on which I will be applying dry heat to your genital area, so as to provide comfort, as this increases your blood circulation and hasten wound healing. So if you have any concerns, just let me know, or if you feel any discomfort, just let me know. Then after that, I will now be providing privacy by putting drapes and screen on my patient. So I have already provided her the privacy by closing the curtains and the doors. I will put the drape. So now I will be putting the drape on you. Okay. Then I will give extra pillow to raise her head. So ma'am, I will be putting extra pillow to raise her head to aid in your. Then I will offer bedpan. So ma'am, I will be putting bedpan. I will support her hips. Dorsal position. So after that, I will now be observing for RIDA. So that is for redness, edema, ecchymosis, discharge, and approximation. So now, ma'am, I will be observing for your episiotomy site or your perineal area, so as to detect if there are any signs of infection. So I will be needing to expose your area, but just enough for me to observe it fully. So I will now be exposing your perineal area, ma'am. Then I will observe. Thank you, ma'am. Then I will now arrange my materials on the bedside table. So here I have already gathered and arranged my materials on the bedside table, on which I can conveniently use it. Now I will be performing the procedure for perineal care. So first is to wash my hands. So this will prevent cross-infection. Then I will now spread draw sheet. So this is to prevent bed soiling. So now I will now be placing draw sheet. And then I will instruct my patient to maintain dorsal recumbent position. So this is for the proper access of the perineum. So ma'am, please maintain this position, your knees flexed, so that I may be able to perform the perineal care properly. And then wear gloves. So this is to prevent cross-contamination. Then I will now adjust the bedpan to my patient's buttocks. So this is to clean the perineum. Now I will be adjusting your bedpan. Okay. Then now I will pour water over the genital area. So this is to wash off the discharge from the perineal area. So now we expose it again and we Now I will clean the genital area using the sterile cotton ball soaked with betadine solution to prevent the entrance of bacteria from the colon into urinary tract. So I will hold the cotton balls using a forceps and clean the area. This is to prevent contamination. And I will use one cotton ball for one swabbing. So now I will clean the genital area with the following order. So I will start to the area that is farthest from me. So I will follow a stroke of 7. So here I will start from symphysis, pubis, and I will follow stroke of 7. So labia majora first. And then labia minora. And then to the other side, labia majora. And then labia minora. And then the clitoris. To the vaginal orifice, to the anal orifice, and then I will clean the perineal region and anus thoroughly. Now, I will remove the bedpan supporting the hip as before. So now, I will now be removing your bedpan supporting the hip. And then turn the patient to one side and then dry the buttocks. So ma'am, can you turn to your side or do you want me to assist you? Then I will dry the buttocks with small towel. After the perineal care is the infrared or Perilight procedure. So here I have already spread the draw sheet. This is to prevent bed soiling, and also my patient is maintaining the dorsal recumbent position. This is for the proper access of the perineum, and I have also worn my gloves to prevent cross-contamination, and also applied betadine solution on the episiotomy site to sterilize the perineal area. So now I will be performing the Perilight exposure. So now I will expose the perineal area for 15 minutes if my Perilight is at 220 voltage, or 30 minutes if it is 110 voltage to infrared light. So this provides comfort and fastens the healing process of episiotomy. So here I am using 220 voltage on which I will be exposing it for 15 minutes. Then I will place the infrared light 18 inches to 24 inches away from the perineal area. So right positioning prevents perineal burn. So here, 18 inches away. Then I will put linen on top. So this will be done for 15 minutes. Now when the exposure is done, I will now remove the Perilight. And the screen. And also, can now then I will record the procedure with the date, time, and the observations made. Now for the aftercare, I will change the linens if necessary. So now, can you move onto your side? To your side again. Then remove the screen and tidy up the unit. Then after that, I will be now washing my hands and record the procedure with the date, time, and the observations made. So that's all. Thank you so much for watching.